So I see you in full screen. You see me in full screen?
Yes, I
Okay.
do see you in full screen.
Okay.
You can see you in full screen, yeah. So, okay, so we can start. Hi, everyone, and good evening. Welcome to HelpC's live chat series. This is our 5th lecture, and today we are going to talk about traditional Chinese medicine and Tai Chi for cancer. So thank you so much for joining us. We hope you enjoy the session. And remember, you can ask your questions that we'll be able to talk to our speaker about and ask them your questions. So feel free to message your questions to us as and when you might have something you want addressed. All right. So thank you again so much for joining us. Today we'll be talking about traditional Chinese medicine and Tai Chi for cancer. And we have a great speaker with us, one of my dear friends and colleague, Dr. Joseph Acquah. Hi, Joseph.
Hi, Sangeeta. Pleasure to be here with you.
Welcome, welcome. So Joseph and I work together at UCSF at the Osher Center for Integrative Medicine. And he recently retired from there. And while he was at Osher Center and throughout his life, he has over 30 years of practice in Tai Chi, 30 to 35 years in acupuncture and in Tai Chi Chuan. He's been involved in all departments of Osher Center, where I have personally worked with him in education, in research, and in clinical practice. And I can tell you he was quite a popular practitioner for us and one of our favorite clinicians to work with for research. Joseph holds a master's degree in clinical psychology. He has done lectures at conferences such as TCM Building Bridges, Women's Health and Alternative Medicine, and Food as Medicine. He's also guest lectured at Yosan University of Oriental Medicine and UCLA. He's a former clinical director and internship coordinator for the California Acupuncture College, has served as an expert consultant for the State of California Acupuncture Examination Committee, and has taught at several colleges, including Emperor's College of Oriental Medicine, New England School of Acupuncture, and American College of Traditional Chinese Medicine. He's a senior student of Master Tung Kai Ying, a third-generation teacher of Tai Chi Chuan. Welcome, Joseph. Such an honor to have you here.
Thank you. Such a pleasure to be here.
Well, so it's nice to be catching up with you after our professional days at Osher Center. And while I know a little bit about traditional Chinese medicine that I had an opportunity to learn with you, how about you introduce what is traditional Chinese medicine to our audience and tell us a little bit about your journey into traditional Chinese medicine.
Yes, traditional Chinese medicine, which you'll see written as TCM, is a complete system of medicine that has been handed down over the last, well, we say 5,000 years, but probably documented clearly for the last 2,000 to 3,000 years. And it includes, we say, diet, exercise, herbs, massage, and acupuncture, as well as, if we will, a psychology and understanding of what it means to be healthy from a psychological standpoint as well. So these sort of 6 areas are included in what we call traditional Chinese medicine. And they all fall within a philosophical or theoretical frame that says that health is about balance and harmony within the body and with nature as a whole. So we are using all of these modalities, or asking people and ourselves to use all of these modalities to attempt to maintain harmony and balance in one's life, and therefore maintain health.
Oh, wonderful. So it's such a whole system of medicine that includes all these components for maintaining health and for healing from different health conditions.
Yes.
It's wonderful, beautiful. Very similar. I see a lot of similarity with the Ayurvedic principles that I have studied in my education.
Exactly. Yes. Dr. Dhruva and I, who you are quite familiar with, who's
Yes.
also an Ayurvedic physician, he and I have spoken on many occasions as we shared an office together there at Osher of the similarities and the overlaps between the two systems, of which at some point in time we hope to be able to write about.
Yeah, absolutely. Absolutely. That'll be very interesting. So tell us a little bit about your journey into traditional Chinese medicine. I know you've taken an interesting path into it.
Yes, and I usually answer that question in a variety of ways. But, from a very young child, I was always walking along. I grew up in central Ohio, and we had a lot of streams and the like. And I was always walking along streams and where I would see the water being sort of stopped and impeded by some sort of branch or some leaves or something that had fallen into the area. I was always finding myself moving that out of the way so that there could be a free flow. I find that very interesting in retrospect because exactly that is the nature of what we do and I do as an acupuncturist in acupressures. We are attempting to move where there's blockages and get things moving along the way. The other aspect of this really from a very personal standpoint is that when my son was 4 years old, he began to have a medical condition that the physicians termed idiopathic. And that term, of course, you understand it, but maybe our guests don't, is a term that means of unknown origin. And when I heard that, I thought, well, there's got to be some other understanding of this. If the Western doctors don't understand what it is, then that doesn't mean that there's nobody that doesn't understand. So I started searching out, and first I found herbal medicine from a Western standpoint, and then I found dietary changes that might have had some impact on health. And then finally, I found an acupressure course that was run by a person who's now known as the Tea Gardens, Ron and Iona Tea Garden. And then finally, I heard a conversation on the radio once that was being conducted by a speaker, and he just noted the idea that at some point there was going to be a new profession in California called certified acupuncturist. And when I heard it, it sort of rang a bell, you know how those things happen. And I thought, okay, that's what it's going to be. And finally, when the first acupuncture college opened in Los Angeles called the California Acupuncture College, I was in that class in 1976, 77.
Wow, so you were in the first class?
I was in the first class.
Wow.
There were a total of 7 of us in that class because at the time there had not been a full approval in the state of California for licensing, but we were told, there was licensing, but there had not been any schools approved. And so we were told that we were promised that if we came to that school that it was going to be approved. So 7 of us had enough nerve to brave it, and we did indeed after 3 years graduate and was licensed, then took the state board, the first licensing board in California, and became licensed acupuncturist.
Wow, okay. This is quite interesting. Well, I know this is a little more academic, but I know I'm curious, and I know some of our viewers might be curious about it. So acupuncture and TCM, it's certified, it's board certified. There is certifications and examinations. I guess my my logic behind trying to understand this, or what our viewers might want to know, is how do they know that somebody is a good and credentialed TCM practitioner and acupuncturist?
Yes. So as I said, in the early days, we were considered, and the first legal authorization was something called certified acupuncturist. And as of you probably know and can assume that literally ever since there have been a Chinese and an Asian community in the US, there have been practitioners of acupuncture and traditional Chinese medicine. However, there was no licensing, and so that people who were in those communities could seek out, and they knew in their own communities who were practitioners. In the early 70s, particularly after Nixon went to China, and one of his, the press correspondent that was with him at that time, James Scotty Reston, had to go an emergency appendectomy. This is 1971-72. The emergency appendectomy was done in conjunction with acupuncture as a helpful anesthesia and with pain relief following it. Well, the United States and the Western world was sort of blown away by this because there had not been in the dominant culture an awareness of acupuncture. Following that, then there began to be an increasing interest in America. People began to search out and go down to Chinatown and Japantown and find acupuncturists. The state and the local governments decided that they needed to then license this profession. There were those people who could show that they had been practicing for a number of years, and they were then grandfathered in after they had documents to show that there was that they had been practicing. After that, which is when I came into the scene, there was then schools that got approved, and then the first licensing exams that were given. We were first called certified acupuncturists, and over the next few years, with more and more schools developing and curriculums being developed, we began to then become a licensed profession. And people now can be assured, because it's been over 30 years, that the state of California has had state board examinations and training programs set up all throughout the state that have trained, and people then take a state board and become licensed acupuncturists.
So there is a good licensing exam that ensures the knowledge and the safety of the practitioner and make sure that they are licensed. So when somebody is considering going to a TCM practitioner, going to an acupuncturist, they can verify that the practitioner holds a valid license in the state.
Yes, they can go to the California State Acupuncture Board and put that person's name in and see their license and their license number, and that they are in good standing.
Great. Well, Joseph, I know you are a great practitioner, because I know how hard it has been for even my patients to get appointments with you, and the ones who do tend to stick with you. When people are looking for a practitioner, what would you suggest in terms of how do they identify a good practitioner? How do they search for a good practitioner beyond the licensing?
Yes, I think that's, the case as you're looking for any healthcare provider. You're looking, first of all, are they licensed? Secondly, do they have a good reputation? Are they usually word of mouth, I always say, is a good way. Somebody has been to that practitioner, and and they're happy and pleased with that practitioner. And those things, are very individualized. So do they have a good bedside manner? Have they given good recommendations in terms of herbal advice, in terms of supplemental advice? Is their acupuncture, I want to say, Is it not painful? um, yeah, those are the kinds of things that I think that people are looking for when they're looking for a good practitioner. And I always think that it's a good word of mouth is a good way to determine and to find a good practitioner. Ask around who has, have you seen this person? Do you know anybody that's seen that person? Yeah, that's how I think best way to find a practitioner.
Definitely, that's great. And in fact, that's what we are doing at HelpC, is making sure that the practitioners that are on our platform are licensed and vetted, and they have good ratings, so we can make sure that our community who is finding the practitioners can have that ease of mind and trust that they're seeing somebody who's very good.
Yeah.
So definitely, very good points. So let's talk.
It's always about the fit. You know, sometimes you can have a wonderful practitioner, but the personalities are not a good fit, and so you select someone else. But that's the skill set is the beginning. Yes.
Yes, true. So let's talk a little bit about acupuncture itself,
Yes.
and then we'll go into acupuncture for cancer.
Yeah.
So you talked a little bit about blockage, right? That
Yeah.
acupuncture helps with releasing the blockage. What I have seen at Osher in terms of the research we have done and in my clients is with our oncology community and even otherwise, I've seen TCM and acupuncture being used for pain, for being used for nausea, and seeing good results there. Also have seen for appetite at times, and a little bit for energy when the person is feeling really tired. So those are some of the common things I have seen in my cancer community where acupuncture has been used. Is there anything else, or can you talk a little bit more about where traditional Chinese medicine is used, and maybe some components are used more than other in certain cases than others?
Yes. Well, as I said, as we've talked about and you just mentioned, all of those things, those areas where research has been done to show that acupuncture's effectiveness. And we talk about blockages, and I talked about blockages because we say that where there is blockages or impedance of the flow of blood and energy or qi through the body, then that sets up imbalances, right? And so we want to move those imbalances, those blockages, so that the balance can take place again. Harmony can begin to manifest itself again. When we talk about qi, oftentimes we talk about, right, TaiChi, we talk about the meridian system of the body, and that is a system of pathways that are, we call them energetic pathways or qi pathways. Now, about 40% of these acupuncture points and this meridian system that has been identified for thousands of years through Chinese medicine correspond to the nervous system. The other 60% or so, we don't have a Western anatomical correspondence to. So we have to then depend upon what I consider and what we talk about is the primary healing system of the body is really what is being stimulated with acupuncture. And the best way I've come to explain this is this. When we cut ourselves, our body heals, yes? We've come to take that for granted. But we're taking a lot for granted, right? The skin is like the border to your country. The moment that the border gets invaded, the body sends out some troops, yeah? Right. A blood clotting factor to prevent you from bleeding to death, some analgesic to prevent you from going into shock, a knitting factor gets released to knit whatever skin is there back together again. Some white blood cells get sent to the area to seal it off so infection doesn't spread into the body. And then there's an increased proliferation of some scar tissue. We call it a scab. And after a day or so, you have a little thin scab. And after a couple of days, it's thicker. And hopefully, after a week or so, it goes away and you've got nice, normal tissue. So that indicates that you've got a system inside of you that's always there taking care of you. It's what the Western doctor and the surgeon depends upon when he cuts you to do a surgery. He depends upon the fact that the body will mend itself back together again. And in the West and Western medicine, this is called the primary healing system of the body. All we're doing with acupuncture is tapping into that system. We break the skin. We break the skin at some very specific sites, once again corresponding to that meridian system that I've just described. And that then is a way of stimulating or jump-starting that innate primary healing system for the healing of the body. That's acupuncture pretty much in a nutshell. We could talk about it in our, vernacular and in our language of meridians and points and chi and, low points and yuan source points and all the rest of that. It doesn't mean anything to the average person. But I think if we talk about it as a primary healing system that is there and present, that we've all witnessed happen, and that we know that the surgeon depends upon, that we've actually looked down sometimes and we've got a scab and we don't even remember doing it. The body's done it for us, right? So we know that that system is in place. Now, if there is a way of stimulating that system, of tapping into that system, that's what acupuncture is.
Wow, you explained that so well, Joseph. It's one of the best explanations I've heard about
That's how I've come. It's taken me some years to arrive at an understanding that could be communicated clearly, and particularly working within a Western, environment, a Western medicine environment. I really needed to be able to explain it in such a way that people could grasp it.
Absolutely, yes. Yeah, you explained it so well in a way that it relates to us. Basically, it's a way of increasing your own body's healing system, tapping into that system and supporting that system to have more energy. Very, very interesting. I have to tell you, my own story here. So I'm scared of needles, okay? But I'm very good at putting needles in other people's bodies.
Isn't that interesting?
I love to start IVs. But I'm the absolute worst patient when somebody has to put a needle into me. Okay. So I'm always queasy when it comes to blood draw. But I wanted to try acupuncture. And I was in between, as some of you who know me, I tend to be a workaholic and can burn myself down working. So I was having one of those situations where I had overworked myself and I could see my energy is really drained and I have some chronic pain issues. So along with my physical therapy, I decided to try acupuncture. So I had gone for pain. Okay. Because I was having pain in my shoulders. And when I went for addressing the pain, it was interesting because the TCM practitioner, doctor, she said, well, you have energy blockage. Your energy is low. So I'm going to work on unblocking your energy, and that energy will then help you with relieving some of your pain. So I actually experienced some of this and I was skeptical. I was like, it's a balancing act. Should I get some pain from acupuncture to maybe have a long-term effect of improving my shoulder pain? So I tried it out. So before I recommend things to other people, I like to first be the guinea pig as much as possible and and validate it for myself. And definitely I saw improvement in my neck and shoulder pain. And it definitely helped me with my healing. Uh, so I can definitely relate so much to what you are saying.
Yes, and I always like to, emphasize, because most of us, our experience with needles has to do with hypodermic needles, right? That you are doing a blood draw from, or that you're getting a vaccine or an injection from. And I always like to point out that our needles are so thin, they will go inside of those needles.
Yes, that's true. Actually, I can vouch for that.
Yes, we are using, and if people know wire gauge, we are using what is your normal size of a needle that you're giving an injection with? What's the diameter? Do you remember? Is it like a 20 gauge or something like that?
Yeah, 20, 24, 28.
Yeah, so we're using, and the higher the number, the thinner the wire.
Mm-hmm.
So we're using 30, 32, 34, 36 gauge wire. Again, so thin so that the experience that we have as most of us just getting an injection or a vaccine or a blood draw, these needles are, so much thinner.
They are much thinner.
So the possibility of them causing much pain is a lot less than you get with an injection, is what my point is.
Yes, it's true. It's true. I would say that for me, it wasn't completely painless.
Right. Yes.
Right. There were some times where I didn't feel it, where I was waiting for the pain and waiting to scream and make a fuss, and I didn't even realize that the needle went in. So
yeah.
there were definitely some times like that, but I think the times, what the practitioner told me was the times where there was significant imbalance or she had to go deeper. At those times, or like some points, like I think she once did it here.
Mm-hmm.
This area, and then once around my belly button, and those I could feel like a pinprick.
Yes.
Like a mosquito bite.
Yes.
That was about the level of pain I felt. Is that common?
Very
should
common.
People be scared, or what can they do if they're scared of needles or of pain?
Well, I'm often asked, do I get people who are just totally needle phobic? And I say no, because they never get to me. but people like yourself who have a little bit of a fear of needles, I like to say to them this. I say that, there are about 5 sensations that you can feel with acupuncture. If I put a needle in you and you didn't feel anything, you'd kind of think that something might be wrong, right? I mean, you don't want to feel anything, but the chances that you're going to feel something, you want to feel something. So in general, I say, when we first put the needle in, there might be a slight prick, not much of anything, like plucking a hair, like, a little pinprick, a little bing. But after that, and more importantly, after that, you might get any of 4 other sensations that actually are good. We want you to feel these. It lets us know that you're going to get the optimal benefit of the treatment. So you might get a little numbness. You may get a little tingling sensation, like something's traveling up or down from the place where the needle has been placed. You might get a sensation of distension, like the area is getting swollen or larger than life. And then lastly, something that we don't want to feel is a sensation like an electrical shock, like you hit a nerve or a funny bone. Each of these are just going to last a second or so, and then it's going to go away. So those are common experiences and sensations that people feel with acupuncture. It is actually, we say in Chinese medicine, there's a term we call TaiChi, and that is where the connection to the needle, to the acupuncture point, to the meridian has been reached. And that allows then for the sensation that we are talking about. And that's a good sign. It lets us know you're going to get the optimum effect and a more beneficial effect of the treatment. Now, not feeling those things doesn't mean that you won't get an effect, but it is a a sensation that we expect as practitioners and that we want patients to understand are good things. It shouldn't be something that causes one to freak out. It shouldn't be painful, right? It should be a sensation.
I like that. It should not be painful, but it should be a sensation.
Yes.
Okay, so you feel a little bit of sensation and it shows that it's doing something.
Yes.
Right, and then it calms down. It's not any extreme or severe pain of any kind. Yes. And it doesn't last. That discomfort doesn't last.
Yes, a few seconds or so at most, a minute at most. Now, we of course we didn't talk about the fact that once the needles are in, we don't just put them in and take them out, right? You usually sit with them for 15, 20, 30 minutes to allow the body to take that message, if you will, from the needles to then do the job that we want them to do. When we take the needles out, the treatment doesn't end. Just like when you cut yourself, you don't get a scab immediately, but a process has been initiated. And so we take the needles out, you go on about your way, but the treatment is still working over the next 24, 48, even 72 hours in terms of a balancing and a healing process that has been stimulated.
Wow. Oh, interesting. So it's happening over the course of 3 to 4 days, right?
Yes. Yes. Again, like when you cut yourself, you don't get a scab immediately, right?
Right.
And we have broken the skin. So we have initiated that healing process. The body has to come to do the work to heal that spot.
Right. Very true. Very true. I remember even for like the needles are put for like half hour, 15 minutes or so. And generally that time has been quite relaxing. And then when I did it for pain, I felt the improvement over next few days.
Yes.
So my question for you is, let's say that somebody is having pain or they're having nausea or one of the conditions that works well for addressing with TCM and acupuncture. How often do you suggest that they see the practitioner? How often do they typically get the treatment?
Yeah, and that's a very individualized time frame based upon the level of discomfort, the type and the level of the disease. I'm sorry about this phone.
No worries.
That the practitioner will make a determination at that point. Let's say you had a sprained shoulder or a sprained ankle, then probably a treatment every couple of days, initially, maybe twice a week for the first week or so, and maybe it will only take a couple of treatments to take care of that. For people who are, as we're starting to talk about cancer patients, sometimes we'll treat them twice or 3 times a week initially, and then as things get better, we will stretch it out to once a week, once every couple of weeks, once a month, depending upon the condition. And again, around treatment. So if somebody's going through chemotherapy, I might see them every other day while they're going through chemotherapy or radiation therapy, just to keep the body and the healing system stimulated. If they're, and then after that, we taper down and see them once a week or once every couple of weeks after that. Yes. So it depends upon the condition.
So let's talk a little bit more about conditions, Joseph. So can you elaborate a little bit more about what are the conditions where you are typically using TCM and you're seeing good effects? And then we can move a little bit into when you worked specifically with cancer patients, what are the times that you've used TCM and what component of TCM have you used with them?
Yes, I'm usually always talking about diet with patients and helping them to, a lot of conditions, we sort of create ourselves through what we eat. And so if I can just get people to eat in a more harmonious way, i.e. not eating too much, not eating too fast, different flavors. So we talk about flavors in Chinese medicine. So as you well talk about also in Ayurveda. So we talk about sweet, sour, pungent, salty, and bitter. And all of these flavors, then if we can get you to blend those flavors, that will be helpful to patients. And for many conditions, digestive problems, which a lot of people suffer from, headaches, we can sometimes eliminate headaches if we can get people to stop eating fried food and heavily fatty food that then causes the liver and the gallbladder to become more congested, right, and blockages along those pathways. So we do it dietarily. And certainly with then acupuncture and herbs we use also in those same kinds of conditions. If we're talking about cancer, as we started to, then we use acupuncture and herbs and dietary things, as well as getting people just simply to walk. If you can get a 30-minute walk in every day, it is so helpful to breaking up those blockages and getting things moving so that there's not then impediments in the flow of blood and energy in the body. So many conditions we use diet and we use exercise in that regard. Almost acupuncture is almost the most radical of traditional Chinese medicine's approaches, where you actually have to then invade the body to jumpstart it, if you will, to get the blockages moved.
Right. So what you're saying is, I think, similar to what we see in Ayurveda is with diet and lifestyle. So TaiChi and with diet advice, it works for most of the conditions, and you're able to help them to improve their health. And when the condition is severe or it needs more radical treatment, that's when acupuncture can be used. So for example, with the case of nausea, where they're feeling really sick and it's hard to address it with diet alone.
Yes, absolutely. Okay. Yes. And, certainly with somebody who is undergoing chemotherapy, they've got this major toxin in their body. And, we need to help them to balance out that stomach energy, because it has been, invaded, if you will, by this toxic chemical, which is doing good, but it's also doing bad. So by using the acupuncture, we can then help with that nausea and help with the lack of appetite that then is a result, which then causes weight loss. Lack of nutrient in the body doesn't allow for the body to then have the things that it needs to continue to heal. So if we can use acupuncture to eliminate the nausea, then we can sort of help with the whole lifestyle after that.
Absolutely. It helps a lot with the symptom management while undergoing treatment, right? So that the additional medications can be decreased and overall the quality of life is better, and hopefully we can stay on the course of the treatment and doesn't have to be postponed or, moved back and forth. Definitely. And I know you've been involved in research, Joseph. So can you talk a little bit more about where you have seen or you're aware of good evidence-based research for TCM and the various components of TCM, because it's actually quite broad when we talk about TCM. So
yes, so we know that, and we have studied at Osher, and we've published studies on acupuncture for pain, post-surgical oncology patients, using acupuncture for pain, nausea, and also for getting the bowel function back and moving again after a surgery that's been on the GI tract. In addition to getting people back up and moving, i.e. Their energy levels, so that they can get involved in their life again. So these are key areas that I have done myself, and at Osher we've done research on minimizing pain. We can also then minimize the amount of pain medications that they have to take, which if they're narcotics, we know slows down the digestive tract, slows them down. So by using the acupuncture and preventing or limiting the amount of narcotics that have to be used, we can help the patient to get their normal bowel function and back up and moving again. Certainly energetically, people feel better. One of the subtle things, but is very important, is you just need to feel good. And if you don't feel well, then the rest of your life is, compromised. And what acupuncture does is, generally, we now know through things that you experience with the endorphin release with pain, right? There's an endogenous morphine-like substance called endorphins that we then know that acupuncture stimulates. You pointed to this point earlier. There's been studies done to show that this point will increase the endorphin level in the body. And endorphins are your endogenous morphine-like substances that then help you to feel better, right? Help you to feel more relaxed. And that in itself then allows you to then go on with your life and feel better.
Okay. Wow. So yeah, so really good points you covered. I'll just summarize them. So you mentioned that TCM and acupuncture is helpful for pain. It's helpful for fatigue. It's helpful for helping with increasing the mobility, so you can move around a little bit more post-surgery, right? Yes. It's helpful for improving the bowel function. It's helpful for nausea. And it's also helpful for feeling good. So it helps with improving the mood and having that generally good feeling to be able to cope with life.
Yes, absolutely.
Right. Wonderful. Wonderful. Really great, great points you touched there, Joseph. Tell us a little bit more. I know we talked about like there are different components of TCM. Can you touch a little bit more on each of them? Because I think many of our viewers might have heard of them individually, but not necessarily that they are all part of TCM and what it entails.
Yes, and so of course, my love is TaiChi and Qigong, and that is the traditional Chinese medical Chinese exercise systems. Right? These are exercise systems that are not like our Western exercise systems that focus on building strength and getting a lot of muscle buildup and keeping your body in shape, i.e. the abdomen with the, what they call it, the six-pack and all that. That's not the emphasis in the use of exercise, Tai Chi and Qigong in Chinese medicine. These are systems that are focused on, as we've been describing, keeping the circulation of the blood and the Qi energy in the body moving through the organs. Also maintaining, we talk about Tai Chi and Qigong both as being sort of moving meditation. So they are a way of helping you to focus the mind and the body together and making them work harmoniously together. So these are exercise systems. Instead of, I always like to say, instead of moving fast, like we like to do in the West, to build exercises and to build strength, when we move slowly, each and every muscle fiber has to do its fair share of work, as well as we then have to engage the mind so that it stays present as you move the body. You're helping and that's the meditative aspect, right? Staying in the present as you move the body. So this is what Tai Chi and Qigong are doing. Tai Chi, there are 5 forms, 6 depending upon who you talk to, forms of Tai Chi that have been handed down from families, and so they have these family names. There's the Wu form and the Hao form, the Qin form, the Sun form, and there's another Wu form. So those are forms, and they are very specific sets of movements that then can last You can do them for, if you do them very rapidly, you can do them in 5 minutes. But if you then do them in a traditional way, you're going to take 20 to 30 minutes to do the completion of the form. In Qigong, there are thousands of forms of Qigong, right? Qi meaning the energy, Gong meaning cultivation. So Qigong, Qi cultivation, and it's a way of helping you to build and fortify the Qi in the body. And so there are many ways to do this. TaiChi, we say, is the supreme Qigong because it is very strict form that is done over time and over a longer period of time. Various Qigong forms, white soaring crane Qigong, 5 sound Qigong. There are many forms of Qigong, and it just depends upon what one likes and what one has an affinity for and can find a good teacher to learn from. Someone who's obviously been practicing a while and can then pay attention to the practitioners or their students to make sure that they're doing it correctly.
Right. So there is Qigong, there is Tai Chi, and that has different forms. There is, you talked about the element of food, right? That being important. And then there is acupuncture. We talked quite a bit about acupuncture, right? And the other one you said is herbs and supplements.
Yes,
correct?
herbal medicine. Herbal medicine. The pharmacopoeia of Chinese medicine is very extensive. There are thousands of herbs in the Chinese pharmacopoeia that have been handed down and formulas that have been handed down and used for, like acupuncture, for thousands of years. Usually done in tea form. And of course, there are also pill forms, and in modern day, many more of them have been put into pill and capsule form to accommodate the American and the modern lifestyle that don't want to have to take the time to boil up these herbs and stink up the house and then have to taste this bitter flavor that they have to drink down. But all of these formulas have been handed down. They now have been studied in many instances to look at their modern pharmacological mechanisms of action and what they're actually doing in the body. So like when we're talking about something that acts as a narcotic that can have an effect on pain, there are these herbs. There are herbs that we now know that can help dilate blood vessels. There are herbs that then help to stimulate the gastric motility in the gastric system so that bowel function can be kept up. There are herbs we know that then boost the overall immune system, right? So all of these, there are all of these components in Chinese medicine's pharmacopoeia that can be used and are used, again, sometimes in capsule form, pill form, traditionally done in tea form.
Wow, yeah, it can do a lot, and I'm grateful that there is pill form because it's it's so much easier.
It is so much easier, yes.
But I also know that the tea form is more effective, and when we can, it's better to use the traditional forms. But it's really amazing how many health conditions these herbs and supplements are helpful for, and they are available in so many different forms.
Yes,
and
let me just say one other thing. We have these advertisements now on the television about things like Icy Hot and these things that are like plasters, right? That you put the tape on the body and it acts as a way of transmitting through the skin to help with pain and discomfort and the like. Well, this is a traditional Chinese medicine that has been handed down. We have about at least 50 different types of these. We call them plasters, that are herbs that are put onto, made into a paste put onto a piece of tape that then are applied to the body to remove pain, and also sometimes to work in other ways as well. But some of them are more hot, some of them are more cooling, depending upon what is needed. So that's another way of using Chinese herbal medicine.
Yes, that's true. I like that.
Liniments.
It's wonderful.
Right? Liniments that we talk about, we use liniments,
Mm-hmm.
jowls for, taking care of sprains, strains, bruises, sore muscles and aches and the like. Yes, so also herbal medicine, another way of our Chinese herbal medicine. And if you go into any Chinatown, go into an herbal pharmacy, you'll see all of these things.
Yes, very true, very true. And I think one word of caution I just want to share with our viewers here is that it's important to be under the care of a practitioner, because they're the ones who can truly guide you on what kind of herbs and supplements are good for you and in what form. Coming from a holistic perspective, Ayurvedic perspective, I know that the same treatment doesn't apply to all my patients, even though it's the same condition. And I'm guessing it's the same for Chinese medicine too.
Yes, it's the same condition from a Western standpoint, but from a traditional standpoint where we're analyzing the patient, they can both be having headaches, but this type of headache is different for you than it is for me, right?
Mm-hmm.
The underlying cause of it is different for each one of us. And I agree, it is very important to recognize the interactions, and this is where integrative medicine becomes so important, because practitioners who understand that if you are taking a Western pharmaceutical medicine, that if they're going to prescribe an herbal formula for you, they need to make sure that it is not going to have an interaction with your Western pharmaceutical medicine. Now, in most instances, that's not a problem if you separate them by distance, i.e. an hour or two between taking them. But in some instances, you want to make sure that you don't take that particular herbal formula with that particular pharmaceutical.
Mm-hmm. Absolutely.
Integrative medicine is the key.
Absolutely, absolutely. Working with your provider, your Western medicine provider, and your holistic provider, so that you can be safe and get the proper care. Very true. I have some questions from our audience.
Sure.
For you. Of course, the first and the most expected question is about insurance coverage. Mm-hmm. So let's talk a little bit about that. What is covered in insurance? I know that as of 2015, there are new rules and regulations which cover acupuncture for certain conditions. Can you elaborate a little bit more about what's covered, what's not, what is pay for service?
Yeah, I'm not as up to date on that as I probably should be or was when I was working at UC. But there is, I know as part of the Affordable Health Care Act, that acupuncture was included in the state of California as it is being administered in the state of California. So insurance companies need to or are required to cover the use of acupuncture by licensed practitioners. For conditions, now that's the key thing. In the past and for many years, what was covered by insurance companies that did cover acupuncture was painful conditions. As we have expanded and as we're talking about the use of acupuncture and acupuncturists in oncology, now more and more of the insurance companies are covering acupuncture when it is being used for nausea, vomiting, fatigue, pain, and the like with oncology patients. In fact, if I'm not mistaken, Kaiser has recently added it to their oncology program. and the Cancer Centers of America, I am told, use acupuncture in their centers. And so I think they're being covered also through their insurance policies. But it's also up to the subscriber to call their insurance company, talk to them about what is covered, is acupuncture covered, how, and are there specific diagnoses and the like that it is covered for.
Absolutely. So we do want to check with your insurance, check with your provider, that way you can know. I did that. When I called the TCM place, acupuncture place, and gave them my insurance information, they were able to check if it is covered by insurance and for the condition I was going for.
Yes.
And they were able to cover it, and I had the copay. And in fact, on our HelpC platform, we are able to search by practitioners that accept certain insurance. So we can make the process a little bit easier in terms of finding practitioners. So definitely. Okay, so next question for you. From our audience, I can see that people have been paying attention. I'm seeing some deep questions here.
Okay.
How do you perceive the energy balance in a person? How do you diagnose it?
How do we diagnose? Yeah, the classic answer to that statement, and we usually say it simply, we say looking, listening, asking, and feeling. So we ask the questions just like when you go to your Western doctor, you fill out a medical history form that gives us a medical history and fills us in on your condition. Then we will look at you and we will palpate points like the old Western physicians did. We actually do a physical exam. We touch the patient, right? But we also are looking, we will look at your continence, the body, the overall energy level. We read the face. We have you stick out your tongue like the old Western physicians did. I don't think they were paying as close attention as we do in Chinese medicine or in Ayurveda, but we look at the tongue. The tongue will tell us, based upon its coloring, its coating, and the like, whether or not various conditions of imbalance in the body. And then lastly, we will palpate the pulse. And we take the pulse at 3 different positions on each wrist, which is, of course, a lifetime study to be able to feel each one of these pulses that then represents a different organ systems, and then we can feel the imbalance based upon that. So it is through those methods that we do arrive at a diagnosis, and our diagnosis of headache, for instance, will not just simply say headache, but we will say you have liver qi rising, right? Which is based upon that diagnosis of the looking, listening, asking, and feeling. Headaches at the top of the head, for instance, if people always are having headaches at the top of the head, we say that is a result of liver qi rising, right? And then we will then treat according to that diagnosis. So it's not just headache, but it is a specific type of headache based upon a specific imbalance in Chinese medicine and from a Chinese medicine standpoint.
No, interesting. Right. Yeah, true. Wow, it's so similar to Ayurveda. And India, it's a full diagnosis. It's an in-depth analysis, in-depth diagnosis of what's going on with a person, and it's not just a standardized treatment. So
exactly, yeah. So
to look at everything.
I asked the patient, one of the common questions that I ask is, do you tend to be hot or do you tend to be cold, right? That's a basic yin and yang diagnosis, and everybody usually has an answer to that question. Oh, I've been hot my whole life, or, oh yeah, I'm always cold, you know? That's a basic diagnosis that lets me know, is there too much yin or too much yang, or not enough yin and yang, and so where the imbalance is in the system. Very simple question. But
yes, this is like the pet question, right? If anybody knows even like 3 lines about Chinese medicine, they'll know
exactly
this question about, are you hot, are you cold?
Yes.
Very true. Well, so the next question we have is, let's say somebody got treatment from you for acupuncture, then what are the things, if any, that they need to do differently after the treatment?
Usually I say there's two things. One is no alcohol, no caffeine, right, on the day of the treatment. These things then begin to interfere, obviously, with the transformation that we are attempting to initiate. So those are the key things. You don't want to go to a sauna. You don't want to go and do a heavy workout. So those are a couple of other things that you don't want to do following an acupuncture treatment that will then interfere with the extent to which that treatment is going to be of benefit to you.
Yeah, good points. Yeah, very good points. Definitely something to keep in mind. Well, I have some more interesting questions, and I'm surprised I somehow missed asking this. Can you talk a little bit about the efficacy of electroacupuncture, acupressure, cupping, and other forms of physical manipulation from TCM?
Sure, yeah. You know, cupping and something also very similar to cupping we call gua sha are ways of then moving the blood and the energy, and it becomes very visual for you because you can see the result of cupping or gua sha because it looks like a big hickey from our perspective in the West, right? There's a hickey, and it is a way of moving blood, right? It's a way of moving the blood and the energy where it has been accumulated. Very, very effective form of manipulation of the body and of physical intervention. The use of moxibustion, which I also did not speak about, which is our way of heating, adding heat to the body when there's cold. And that is an herb called, we call it moxa, but it is from the mugwort family. It's Artemisia vulgaris. It is aged for a period of time. We then light it and we hold it over the acupuncture points or hold it over the needle that then allows the heat to transfer down the needle into the body to then warm a cold condition or to add energy. Electroacupuncture is a modern thing developed in the 1960s and 70s as the West, as China was attempting to become more scientific and modern, and also to see whether or not there was a different way of stimulating the acupuncture points with in the acupuncture system using the electroacupuncture. It is done in a variety of ways. It's not like you're going to get electrocuted. There are what we call microcurrent acupuncture, electroacupuncture, and then there is a stronger current, usually attaching small electrodes through a machine to the points and then stimulating them just to get a little bit of a sensation in the body from it. And the studies that I have seen, unless there are very severe conditions, if a good traditional acupuncturist using traditional acupuncture and electroacupuncture, they're pretty much going to be the same.
Wow, interesting.
Yes.
Interesting. Wow. And some more questions in this area, and I will save my cupping story for later for you, Joseph, as much as I want to go over it. Okay. I know we don't have enough time. So
everybody's got a cupping story, by the way.
Everybody has a cupping story, right? Well, I'll go to the next question. That'll be good to our readers. So can you comment on if TCM can be used with other alternative therapies and with Western medicine therapies?
It normally is. I don't think I see anybody that isn't also being seen by a Western physician. Many times my patients are also, particularly if they've been in accidents or something, they're also seeing chiropractors. They're also seeing massage therapists. In fact, I have massage therapists that I refer to help patients along the way. So yes, all the time we're using in conjunction. I am an integrative physician.
Wonderful, wonderful. So what's other type of therapies, like you mentioned chiropractor and massage, are those the common ones? What else do you
Yes,
typically?
those are the most common.
Mhm.
I also refer to my office mate, as you know, Dr. Mei Ling at UCSF, is
Yeah.
trained in manual therapy, and that's like an osteopath. So I do have one or two osteopaths who do manipulation that is similar to chiropractic but different. And so I will refer also to osteopaths, and they are wonderful practitioners, or manual medicine practitioners. If you were trained in Europe, they call it manual medicine. Yes.
Great.
And I will oftentimes, and as you know, in
Mhm.
oncology patients, you have to have, sometimes you have to have a psychologist involved. So I refer to psychologists and sometimes to psychiatrists if necessary, but more often to psychologists.
True. Very good point. Very good point. Yeah.
Post-traumatic, people who go through cancer therapies and the like, just the entire process of going through cancer, let alone all the therapies and the like, can be quite traumatic. And so they need a therapy or a therapist to work in conjunction with.
Absolutely, absolutely. And I think it's so wonderful to have a great team of integrative practitioners who work together to address the whole need of the person, the body, mind, the
Yes.
soul, all the health conditions. It's so great that you work with a team. So definitely, I think for our viewers, it's totally okay to have a team of practitioners, of alternative medicine practitioners. Just have them talk to each other, have them
Yes.
be aware of each other's
Yes.
presence in your life, and they can actually work together to provide a comprehensive treatment and a plan to better support you.
Yes. Yes.
Right.
The traditional African saying that it takes a village, right, to raise a child. Well, it also takes a team to help heal in many instances. So yes, you should have a team that you're working with.
Absolutely, absolutely. It's great to have a team to work with. I will ask you one more question. I know we're a little bit over time, but I want to ask this question because I know some viewers have had this question. Is how do you decide between acupuncture and acupressure?
Severity. Think about acupressure as massage. So you would use massage for various conditions, sometimes for, sore muscles, sprains, strains, and the like. If you had a more severe condition, then you would want a more severe treatment modality, and that's when you would use acupuncture. So if you've got a headache that you started having headaches, or you had a sore hip from something that you did last week, oh yeah, okay, go and get a good acupressure treatment. If you've been having this for the last 6 months, maybe you want to see the acupuncturist.
Okay, that's a good way to figure out where you need to go based on how acute your symptom is, how long you've had it.
Yes.
Very interesting. Great. Well, Joseph, this has been so wonderful. Do you have any last words of wisdom before we wrap up, or do you think we have covered all that we could potentially in an hour?
Yeah, I think we've done quite a good job here of covering things. I'm glad that the last things have come up, because we hadn't covered those. We hadn't talked about moxibustion, and we hadn't talked about cupping and the like, nor had we talked about the necessity for psychologists and for the team approach, particularly the more severe conditions that people are suffering from, that we should indeed engage a team approach. And I'm glad that this came up. I'm glad we went over time for this so that could get in here. Yeah, good. Thank you.
Yeah, absolutely. Well, thank you so much, Joseph, for your time. You are such experienced and wonderful traditional Chinese medicine and TaiChi practitioner. You have so much wisdom, and thank you for coming and sharing so much of your knowledge and wisdom with us.
Well, thank you.
And
You know, you're so kind to have me, and I am so blessed to have you as a friend and to have you to invite me to participate in Help See and to be able to share this amount of information and knowledge that I do have. Thank you.
absolutely. And thank you so much to our viewers. Thank you for being open to learning about different healing modalities and how they can support you. Thank you for being with us, listening to our speakers. And we are here for you. We want to support you, to empower you in your health, in your healing, in addressing your challenges. So please let us know how we can help you further. We are at your service, and we are here to support you with both knowledge as well as with access to the best of experts to address your health conditions. And we hope that you will tune back in next month for our next lecture series that will be focused again on cancer. So thank you so much again for your time, and have a good night and good health.
And good night, all.